Welcome everyone to today's HCWH Europe webinar. My name is Arianna Gamba. I serve as Procurement, Policy and Project Officer at HCWH Europe, where I coordinate our project towards plastic-free healthcare in Europe. Today I will be the moderator of the webinar, and soon I will explain to you the outline of the meeting and introduce our speakers. But first, I would like to remind you that all participants are muted, and therefore if you have any questions, please use the chat box and we will address them in our Q&A session. I also would like to mention that almost 300 people from 30 countries have registered to this webinar, and this can give us an indication of how addressing plastic pollution in the healthcare sector is gaining momentum and becoming even more important during this pandemic that is causing an increased use of disposable items. To set the scene of this webinar, I will first share more information about our pilot project, and then our great speakers that I thank to be here with us today will share their success stories in reducing plastics in their facilities. We will start with Oliver, who is the Sustainability and Environmental Manager at Sussex Community NHS Foundation Trust in the UK. He delivers wide-ranging sustainability projects within waste management, circular economy, travel and well-being work streams. Our second speaker, Estefania, is a pediatrician at University Hospital Virgen of Arizaca, based in Murcia, Spain. And in her current role at the Pediatric Environmental Health Unit, she is working on environmental toxins in reproduction and childhood, and she is the doctor responsible for breastfeeding bank donation process. And Dulce Sinfundo, our third speaker, Amy, is a Sustainability Officer at the Newcastle upon Tyne Hospital's NHS Foundation Trust, the first healthcare organization in the world to declare climate emergency. Amy assists in the management of waste, carbon emissions, and has worked on a number of projects to improve the sustainability of catering, including the use of single-use plastics within its delivery. After the Q&A session with our three members, I will briefly mention the next project steps and the opportunities for you to engage in the project. So please stay with us until the end of this afternoon. But before we dive into our topic, I'd also like to give you a short introduction about who we are and what we do. We are an international NGO that brings the voice of healthcare professionals to the European policy debate, but that also raises awareness and informs the healthcare sector about the importance of the environment. Our vision and missions are to mobilize healthcare leaders and professionals to achieve a sustainable, healthy world by transforming the healthcare sector to protect public health and tackle climate change. In the European Office, our programmatic work promotes the sound management of chemicals, climate-smart healthcare, the importance of introducing organic and plant-based nutrition by reducing food waste. We also look at the impact of pharmaceuticals on the environment and antimicrobial resistance. And as the topic of this webinar, we promote sustainable procurement practices to reduce the negative health and environmental impact of the products and services purchased by the healthcare sector. We work on these areas closely with our diverse network of more than 140 members and strategic partners across the European region who are hospitals, healthcare facilities, regional authorities, and environmental NGOs, to mention a few. All these is part of a global network of Green and Healthy Hospital, GHH, that is made of more than 1,000 members representing 30,000 hospitals and health facilities. I would strongly encourage all the participants of this webinar to join this community if you're not part of it yet. So about our project. The project towards plastic-free healthcare in Europe was launched in February this year, and it's supported by the Flotilla Foundation. The goal of the project is to reduce damage to human and environmental health from plastics used in European healthcare. We are implementing the project with 8 of our members based in 6 countries, and together with them, we hope to identify opportunities to minimize the use of disposable plastics and replace them with safer alternatives. And ultimately, through this project, we would like to embed the circular economy model into healthcare practice. Our activities develop across 3 pillars, being them research, education, and innovation. We are therefore collecting more information about the categories and quantities of plastics that participating hospitals use and dispose of. And basically, by carrying out hospital waste audits and by looking at their procurement data, we want to measure the volumes of plastic waste generated and map out key replace, reuse, recycling, and disposal options. At the same time, we want to raise awareness among our members on the health and environmental impacts of their plastic use and suggest actions to reduce its harmful effects. And the hospital involved in the project are building plastic action teams that can be our champions and inspired to take action in their facilities. With the 3rd pillar of our project, we want to stimulate innovation and stimulate innovative problem solving and mobilize the demand for sustainable plastic and packaging alternatives to transform the market. And we're doing so by facilitating a plastic working group that works on sustainable procurement criteria. And we will also organize a market transformation workshop where stakeholders can discuss the sector unmet needs and think of innovative and more sustainable solutions. So, learning from this process, we will make available for all our members a toolkit and communication tools, as well as procurement templates to support action in this field and monitor progress. And we will, of course, continue to disseminate the results and best practice through our webinars, events, and webpage. In terms of progress, so as the rest of the world, the project has not been immune to the COVID-19 pandemic, especially because many of our activities should take place at the hospital's facilities. But at the same time, the pandemic has been a wake-up call for the healthcare sector and is giving a push to look at, for example, reusable solutions that will make our healthcare systems more resilient in case of shortages of key supplies like personal protective equipment. So for the moment, we focused on collecting the procurement data to identify the most common purchased plastic items and to prioritize the products that we would like to work on when discussing the sustainable procurement criteria. And not surprisingly, the group is starting to work on PPE. But on the other hand, some of the products that came up in the research are either a bit easier to tackle, or we have already identified examples of how hospitals are addressing them. And therefore, we are collecting and sharing best practice examples on how to reduce and eliminate these products. And this is what we are doing through this webinar. So now, without further ado, I'd like to give the floor to Olli, who will talk about replacing dressing packs with individual items, both in bulk, and he will also introduce their Plastic-Free July initiative.
So yeah, just thank you, Ariana, for the great introduction, yeah, good afternoon, everyone. I don't need to labour about who I am because that's not so important. But yeah, just wanted to talk about what we're doing at Sussex Community Trust and the action that we've taken on plastics. So just a bit of background about our trust. We cover a population of 1.3 million people. We have about 5,000 members of staff. We provide care to over 9,000 people a day. Our annual turnover is also 230 million. But probably one of our biggest challenges is we use probably over 113 different buildings. So we're quite a spread out organisation. We're not just in one giant hospital. And we've got a sustainability programme called Care Without Carbon. Hopefully some of you have heard of it. Really, we've been spending a lot of time sort of honing this. It was really developed and pushed forward by Will Clark, which some of you may know, who works for Healthcare Without Harm. And we really split it into these kind of different areas. So we've got seven different areas of sustainability, and the one I wanted to focus on today is looking a bit more into kind of circular economy. So just to break that down a bit, some of you may have heard a bit about circular economy, but I just wanted to sort of cover the basics really. This is a very simple diagram of circular economy. It definitely doesn't capture everything there is to know about it. So I do encourage you, if you are new to circular economy, I do encourage you to just kind of go off and look at that. The Ellen MacArthur Foundation is actually a really good source for more information. But just to kind of go through, if you see the sort of the orange arrows in the middle and that kind of line of extraction, production, product manufacturer, distributor and user, this kind of linear system is the economy that we're currently working on. So we extract natural resources, we create products, we use them for a short time, and then we dispose of them, and we lose them through the system. So we really got this kind of leakage of materials through the system, and then they'll either go to landfill or they go to incineration. If we're lucky, we'll get a bit of energy recovered out of them, but that's really kind of the general destination for most things. And throughout this process, with all this intensive sort of material and energy input, we are inputting lots of sort of fossil fuel-based energy and also, human labour into these products as they go through this system. That is all kind of lost when we incinerate it, or we just lose it at the end of the system. So a lot of human effort, physical human effort, is going into making these products, and we are losing it through it falling out the other end of the system. So you can kind of see the loops here. So these are the different sort of material loops to try and create this circularity of materials. So you see recycling on the far outside there. That is kind of the least favourable option because it goes in just before the product manufacturer stage. You are saving a huge amount of energy and labour from the extracting and mining of resources, but you're still losing all the energy and labour that has gone in at the product manufacturer stage, at the distribution, and sort of at the sort of use or packaging and that kind of thing. So we really need to kind of tighten these loops into redistribute and reuse as much as possible. And the most favourable option out of all of these is really kind of looking at reduction and not using materials in the first place. Okay, so just a bit of inspiration on kind of the approach we've taken to plastics here is looking at the Ellen MacArthur Foundation's New Plastics Economy. It's probably a few years old now, but it kind of really sets out a good framework for how we can transition to new types of a new way of looking at plastics in a circular economy context. So it's looking at eliminate, innovate, and circulate. So we're kind of really taking that inspiration as much as we can at Sussex Community. This kind of leads me on to our case study looking at dressing packs. So as I mentioned, we're a community healthcare trust, so we do a lot of healthcare to inpatient homes. The picture of the team you can see really enjoying their e-bike there are the hospital at home team, and they've really been sort of the key part of this project that we've been working on. And Marcello, the team leader in the middle there, really enthusiastic member of the team came to me one day and was really sort of upset about the fact that they were creating so much waste, so much so that he had bagged up a load of the waste that they had created in that day and physically showed me in terms of black general waste bags of how much they were throwing away. A lot of this was to do with the dressing packs they were using. So a lot of the times they were going into patients' homes, they were dealing with patients that had just left hospital, and the idea is that the service is trying to keep patients out of hospital and somewhere that's a bit more comfortable. And they're doing things like IVs, but they were getting through over 30 dressing packs a day with the services they were providing to patients. So this is kind of like a typical dressing pack. This is what they would typically be using. There are other dressing packs available. This is not sort of a bias towards one manufacturer, but this is kind of what they were using. So you'd have sort of cotton swabs, a couple of plastic-based water repellent sheets, a waste bag, examination gloves, a paper ruler, a tray for some reason, I'm not entirely sure what that's used for, a hand towel, an apron, and the second sheet that I've just mentioned. So that is all sort of encompassed in a peel pack, which is just a sort of wax paper and some more plastic film, and then they're kind of bulked up in sort of packs of 20 in a larger sort of plastic bag. So everything in red there is a plastic material, and a range. You can see sort of we've got the polypropylene, and we've got I'm sure we've got well, probably nitrile or PVC gloves, and the water repellent sheet is probably made of a different type of plastic as well. So we do have a sort of range of different plastics, which makes things complicated as well. But the key concerns that the team were having is that they were using a lot of this unnecessary packaging. Everything was packaged in these little handy dressing packs. There was a lot of unused items, so they would open the pack and they may only need to use one cotton swab, mainly for comfort, just to tuck under where the IV goes into the patient's arm. That was just to provide a bit of comfort, but apart from that, they didn't need it. So a lot of items were not even being used, they were just being thrown straight away after opening the dressing pack. And then there was also unnecessary items. So there were some things that were there that, when we looked at the process and what they were doing to carry out that IV infusion, then they didn't actually need that equipment in the first place. So just go to the next slide. This is just to summarise what I was basically saying. So the other thing there was that a lot of it was lightweight, and it sort of took up a large volume, especially if patients were being visited regularly. That would either need to be collected as clinical waste or would be placed in the household as waste, and then that would fill up their own bag. So the team were in quite a good place already, because they were breaking rank a little bit and using their own wipeable trays and reusable boxes to take in the equipment into the patient's home. A lot of other teams were just using sort of plastic bags to take a lot of their equipment in, and they didn't want to use that. So we talked to them about switching to individual items instead of purchasing dressing packs, and they were quite interested. They saw it as a really good way of reducing the wasted items that came in the pack. And you could buy sort of in bulk, all of these items you can buy in a big pack. So gloves, aprons come on a giant roll, sort of cotton swabs will come in a big pack. So they could only take what they needed to the patient's home. So the only big hurdle that we came across was there was one thing that they wanted to not have to use gloves to draw up the medicines, to prepare the medicines before they go over to the patient and then set up the IV. They didn't think it was necessary. The technique they use is the ANTT. So I can't for the life of me remember what the acronym stands for, but it's a non-touch technique. So it's I think it is actually antiseptic non-touch technique. So that there isn't any risk of sort of infecting the patient, especially when just drawing up the medicine initially. So they felt they didn't need gloves, and to do that we would need to rewrite the current trust policy on that. So we engaged the infection control team, we got them involved, and then we rewrote the policy to allow for not using gloves as long as proper hand hygiene was observed, that they could draw up the items without using gloves. So that reduced another item that was being used. So sort of the lessons from this, unfortunately we don't have any sort of real data. There is a need for us to just kind of measure the impact of reduction, how much waste we reduce, how much carbon and economical savings. But there has been interest with the IB team, who are sort of kind of another segment of the hospital at home team. And they've been reducing their use of dressing packs as well. So we really do need to do some work into looking at the carbon savings. It's really difficult because you need to look at all these individual items on a case-by-case basis. It is possible, but it takes a bit of time. So we're really kind of keen to see the benefits on this. And recently we've also realised that it's a much bigger problem than we realised. So looking at the procurement data recently, within just our trust alone, we had purchased 132,000 dressing packs in 2019 to 20, and this doesn't include the dressing packs that the team was using because they are purchased complicatedly through another trust. So actually scraping the surface of this and looking at dressing packs as an area was a real sort of eye opener. And this kind of the second thing I just wanted to touch on was the work we've been doing to engage colleagues within the organisation and staff on sort of acting on plastic and doing their bit to sort of tackle this. Because really it's the clinical members of staff that know what materials they're using, much like Marcello and his team. They know exactly what they're using and what they're wasting. Being on the front line is really kind of important. So we prepared a bit of a toolkit for Plastic Free July. We did last year. It had sort of facts about plastic pollution. You can kind of see some of there on the right hand side. We also sort of encourage teams to think about what are the top 10 plastic items that you used within your team, and have a think about how you can sort of use different items. We had some helpful questions to get them thinking about what kind of alternatives they could choose, perhaps thinking about where that plastic has come from, and really supply chain has been highlighted as a big issue recently. And then also for them to, if they didn't feel like they wanted to raise it at work, what could they do at home? And we gave them examples of plastic items around the home and what alternatives they could use. And then we had a case study in there, so it was a pretty packed toolkit. So we sent this out via our Care Without Carbon envoys, which is just a fancy name for a sort of a green champion, and they delivered the toolkit directly to their teams. So the second kind of thing we did in Plastic Free July was we also gave the option to staff members to take a pledge. So 125 members of staff took this pledge to use one less piece of plastic at work. So this was kind of really focused on, what could people do within their own working lives, whether that's bringing a reusable water bottle or, switching a certain item, what could they do to use one piece of plastic? And we had sort of good take up on that. I say sort of 125 sort of lightly because we do believe there was a lot more staff doing it, but things like these are really difficult to measure, including with the kind of carbon savings as well. So I would really love to give you some more facts and figures, but we just haven't been able to sort of put the time into that to kind of gather that data. But I really hope that we can do that in the next sort of few months. sort of work on plastic has kind of exploded, really even more so during the COVID response. We've just an enormous amount of work is going on, as you can imagine, looking at PPE and plastic use, and it's kind of really opened the floodgates as to work in this area. So one of the biggest areas we're looking at is reusable PPE. I know that might sound a bit like an oxymoron, but we're in the recent issues with supply chain, security of supply, thinking back to that circular economy diagram of where we're getting our materials and how they're being manufactured these are really important questions that we need to tackle. And I think we can no longer rely on these just-in-time supply chains. A lot of our materials coming from the Far East, when we can own that material and we can reuse it within our hospital systems. Yes, it's an enormous challenge, and yes, it will require some innovation, but I think it's a really exciting time to look at this area. The other area we're working in is, Ariana's already mentioned, is the plastics project that Healthcare Without Harm is going forward with. Another thing that Amy will touch on is the NHS Plastics Pledge, but we are trying to do that on a kind of regional scale because we're a small trust. We really find the benefit of multiple trusts coming together to tackle that. So we're working with about 5 different trusts in our region. We've only got to sort of submitting the data on that kind of side of things. Gathering the data for 5 trusts is an enormous challenge with all that procurement data, but we're really kind of pushing forward on that. I've mentioned the DARE thing, but we're also looking to reduce our gloves through a project that was delivered at Great Ormond Street. Really recommend you go and look that up. Some really good stuff that they've done just to reduce glove use on the wards and within clinical areas. We mentioned plastics within our waste training, and we are looking to remove plastic cups. They are the bane of my life. I hate it whenever I see people using plastic cups unnecessarily when there's a kitchen with sort of glasses and mugs right next door. And just very lastly, I just wanted to get you all thinking about laundry. And I was having a discussion with another sustainability manager recently, and she raised the idea about all the microplastics and fibres coming out of laundry, and where are they going, and are the industrial laundries that we're using at hospitals, are they thinking about microplastics? And there's some really great work at Plymouth University looking at the issue of microplastics from washing clothing items that are made from plastic, and whether they can attach sort of some sort of devices to the domestic washing machines to trap these microfibers before they go down the drain. So it'll be really interesting to see if anyone's done any work on that, or whether anyone has any ideas of how we can tackle that from the sort of industrial laundry sort of perspective. So that's a sort of an area of interest that we're keen of looking at. So I think that's my last slide. So yeah, thank you. I don't know whether we're doing questions now or after, but thanks.
Thank you. Yeah, thank you very much, Oli. Informative and inspiring present. We do have a lot of questions for you already, but we're collecting them, and we will come back to it after the 2 other speakers. So I'm now in the presentation of Estefania, and I will pass her the ball, and I cannot do that. But in the meantime, I will just say that Estefania will present to us how the Pediatric Environmental Health Unit is replacing plastics used in milk banks with glass. And although the plastics for the milk bank might be a very small proportion of the plastics used in their hospitals, we think that this is a very important project given its focus on the patients that are more vulnerable to the toxicity of plastic additives. So, Estefania, the floor is yours.
Thank you, Oriana, for your introduction. I'm a pediatrician in Hospital Virgen de la Resaca in Murcia, Spain, and I'm responsible of donation process of the milk bank. Our hospital is the reference hospital in the region of Murcia, located in the southeast of Spain. It's a poor region with 1.5 million inhabitants. The hospital has one of the two pediatric environmental health specialty units, PESU, in Spain, located in the pediatric service. PESU is a clinical unit where pediatricians and nurses with experience in pediatric environmental health cooperate with other health professionals like doctors, family, obstetricians, and other areas like biologists, engineers, architects. We work to recognize, evaluate, and manage disease and risks environmentally related to children, as well as provide education, training, and research. If you are more curious about us, about how we are, what we do, you can find some more info in our website. PESU collaborates with Healthcare Without Harm since 2001. We collaborated in 2004, for example, in the identification of phthalates in plastic. We have done a course on environment and breastfeeding. We have several publications about it. Also, alternatives to the use of plastic and phthalates in pediatric service. And we have also a series of publications about sustainable hospitals, also undergraduate and postgraduate training. 14 years, we have been delivering 40,000 informative letters on how to store breast milk and infant food using always glass instead of plastic. Also, we have removed 100,000 plastic bottles at our hospital restaurant. For us, breastfeeding is an ecosystem. We follow organic food criteria. The milk bank will be implemented in our hospital in September, following PESU's demand, selecting glass containers and promoting organic food criteria to breastfeeding donors. Getting glass containers in from plastic containers wasn't easy. What were our arguments? First, and the most important for us, is the special vulnerability of the prematures. The highest metabolic requirement per kilogram of weight and the immaturity of the detoxification and defense system makes them especially vulnerable subjects. Also, they don't make decisions and they have a limited diet. In the other hand, we have the generational paper. You can see here in the table neurotoxicants like PCBs, polychlorinated biphenyl, coming from mothers, found in the meconium, first stool of the newborn with level up to 19%. Another important topic is the pre-use ban on infants from other plastics, as bisphenol A and phthalates. The transfer of phthalates in packaged food depends mainly on fat-rich food and processes in which the product needs to be heated. The fat-soluble nature in the breast milk and high temperature of pasteurization increase the leachate of plastic polymers. There are many publications about chemical migration in plastic container of polypropylene to the infant feeding. The plastic industry is an oil-derived one. There are thousands of chemicals derived from plastic that can migrate. That is preventable health risk, especially in premature group. Another key factor is that plastics are bioaccumulative, not biodegradable, and persistent contaminants. PET and PP are the most used in pediatrics. Generally, their degradation consists of the splitting into smaller polymers, polluting the different ecosystems, the well-known microplastic pollution. Microplastic pollute landfills and oceans. Single-use plastic increase waste. Most plastics end up in landfill or incineration, emitting toxic substances. The global recycling rate of plastic ranges only from 1 to 10%. Plastic generates and stimulates the trash culture. For us, glass is the best alternative. Glass is being used in other milk banks with security, not easy to broken and with a systematic microbiological control. Plastic change the taste and smell of food. We made a research about that and we freezed some breast milk in PP and some in glass. We defrosted them 3 days later and gave it to the mothers to drink. They all identify milk preserved in glass as the one with the best taste and smell. We have absence of migration risk, and glass it is 100% reusable. Also, glass boosts local economy. We have a lot of glass companies in Murcia, so glass is the best choice. We are committed to our environmental and breastfeeding policy, introducing organic feeding criteria and not allowing the use of plastic containers. For more info, you can see here a summary made with our policies. The most difficult was that the market to acquire this product is flooded of plastic. Only 2 of the 50 milk banks in Spain use glass containers. In both cases, they are reused. The process that limits the use of glass containers is pasteurization. There are 3 manufacturers of equipment for milk banks in the European market. 2 use immersion in water holders, that is the reference method. Plastic or glass can be used. Transculture pushes this selection into plastic. New methods emerged, like drying methods, direct head contact transfer. The use was designed only for plastic containers initially. The journey has not been easy, but finally the market is attending a global requirement. Redesign of the pasteurization equipment, dry method, for use of glass containers with identical microbiological variances as plastic containers. For us, breastfeeding is an ecosystem. We want a toxic-free milk, more healthy, and organic milk. The criteria created a dog that we include are non-smoker of mother exposed to legal and illegal drugs, review occupational and hobby exposure of breastfeeding chemical risks, biomonitoring of environmental pollutants, metals and organic components, avoid use of pesticides and other chemicals at home, previous days, controlling drug and parapharmacy exposure, and basic food questionnaire. Human milk is a human tissue. It's not considered in the food regulation. We are aligned with the strategy from farm to fork, also with environmental health and breastfeeding committees of the Spanish Pediatrics Association. We work together. Finally, we have our goal. First, a safer and organic milk bank towards toxic-free and sustainable milk bank, and a process in accordance with our environment policy and our breastfeeding policy. Thank you very much on behalf of our team PESU.
Thank you very much for this presentation. Again, I encourage the audience to write their questions in the chat box so that we can come back to it after our next presentation. Emmy will talk about reducing plastic products used in catering and replacing them with reusable options. And I would like to stress that disposable catering items made of plastics came up often when researching for the most common plastic items used in the hospitals. Emmy, I'd like to start with your presentation.
Thank you for the introduction, Ariana. Good afternoon, everyone. My name is Amy Johnson, and I am one of 2 sustainability officers at Newcastle Hospitals. My role is varied and includes a wide range of sustainability considerations, including waste, communications and engagement, and procurement. And these sort of all come together, I think, when with reducing plastics. I've worked closely with our catering manager to introduce sustainable measures within catering, and I'm going to talk you through a couple of the plastic reduction measures this afternoon. So a brief introduction to Newcastle Hospitals. We have been providing patient-centred healthcare to communities in the northeast of England and beyond for 250 years. We're one of the largest NHS trusts in the UK and offer a wider range of specialist services than any other. We have around 2 million patient contacts a year and serve a population of 3 million with a £1 billion turnover. We have around 15,000 members of staff and 1,500 acute beds. We operate over 7 main sites, including 2 main hospitals, and then have many community sites on top of that. We were the first NHS trust and indeed the first healthcare organisation in the world to declare a climate emergency. Since making the declaration, the Trust has played a pivotal role both regionally and nationally, working in collaboration with civic partners in Newcastle to take individual and collective action. Climate emergency action, carbon reduction, energy efficiency have been embedded as a strategic priority for the organisation. Our breakthrough objective for 2020-21 is to establish a climate emergency strategy and roadmap to net zero carbon by 2040, taking action to reduce carbon, improve air quality and reduce single-use plastics. We have SHINE, which is Sustainable Healthcare in Newcastle, as a strong brand we use alongside our sustainability work, and these key action areas we cover on the screen now, along with our sort of general aim for what we hope to achieve. The NHS long-term plan made several firm commitments to protect the environment for health, including reducing the NHS contribution to single-use plastics. As one of the UK's largest procurers and consumers of goods, the NHS has a responsibility to act wisely in how we use resources and dispose of our waste. We have signed up to the NHS Single-Use Plastic Pledge, which sets out targets for reducing single-use plastics used within our trust. These products included things like stirrers, straws, plates, things you can see on the screen, because they are in the top 10 contributors to the plastic waste that accounts for 70% of all marine litter. The NHS supply chain data from 2015-16 indicated that catering products account for more than 5,600 tonnes of plastic waste procured by the NHS. This pledge allows for exceptions where there is an identified patient need. For example, in our intensive care units, paper straws were unable to be used due to the abilities of some patients and the amount of time the straw sits in the drink for them. So they will continue to use plastic straws until we can find an alternative. I believe these slides might be available at the end, so I've included a link if people wish to read about the NHS Plastic Pledge in more detail, including the reporting requirements. If not, if you Google it, you should find some information there. I'm going to talk about catering for patients on wards and in clinical environments, as well as the catering provision we have for staff and visitors. Our catering is done in-house, though we do have some commercial outlets such as Subway and WH Smith that also provide some food and drink to visitors. But I won't really be talking about those much today. This is about what we do ourselves, and that is the majority of what we produce. We have one main restaurant serving food 7 days a week, and 2 staff-only bistros or staff-only sort of restaurants which operate on weekdays. On top of this, we serve around 2 million patient meals and snacks to patients, mostly across our 2 main hospitals, the Freeman Hospital and the RVI, the Royal Victoria Infirmary. Within the food service areas, we've introduced a few measures to reduce single-use plastic and are moving towards reuse where possible, though we have had to introduce some replacement disposable items, which we hope to replace in time. We have introduced reusable cups and water bottles for sale and introduced incentives for reuse, which I'll talk about in more detail on the next slide. And we have reusable plastic takeaway boxes for meals that cost around 20p for customers to buy, but can be reused in our catering facilities. We have also changed from plastic cutlery and polystyrene takeaway boxes to wooden cutlery and bagasse-based boxes. Bagasse is a fibrous matter which is the byproduct left over from the production of sugarcane. This bio-waste product was typically just disposed of, thrown away or burned, and as it had no practical application. We need to keep a disposable option, at least for now, for people taking away food, as we found that people took the metal cutlery that we had in the restaurant and did not return it if we didn't have an option available. To incentivize reuse, we introduced a 25p discount on hot drinks when you bring your own reusable cup. We also have eco-to-go cups for sale, where you get your first drink free as well, which has been very popular. These cups are made from rice husk, which again is another waste material that would otherwise be disposed of. The product is compostable when buried in soil and biodegrades within approximately 6 months when disposed in this manner. The silicone lid and guard are recyclable. It was important for us to not just go with the cheapest reusable cup we could find, as we did not want to add to the plastic problem. As reusable cups have a higher embedded carbon footprint, we did not want them to be treated as disposable. We wanted them to be something people held on to and reused again and again and again until it couldn't be reused anymore. So we were happy with the slightly higher cost and the higher cost that we passed on to consumers to get this end. When we introduced the cups, we ran a poster campaign at the same time. This focused on telling customers and staff that disposable coffee cups could not be recycled in our recycling bins. This had two benefits for us, because one, we reduced the amount of contamination in our recycling stream. Coffee cups, when thrown out, usually have about an inch of coffee left in the bottom, which then goes over all the other recyclables within the bag. And two, there's a big public perception that recycling is the pinnacle of sustainability. And when people realised that their daily coffee cup wasn't being recycled, it encouraged them to change behaviour. So the next time they were up at the front and they had that decision in front of them, do I go for the one that can't be recycled, that I have to put in the black bin, or I buy a reusable that was there in front of them, easily accessible? You know, it helped make that decision. Introducing the cups obviously had an environmental benefit, but it also provided another source of income and allowed us to promote our Shine brand further. So you can see people walking around the hospitals with these. And it's good, you know, with projects if there's other benefits to help you sell them to whoever you need to convince to introduce things. In 2017, a decision was made to bring about a joint approach to food and catering provision for patients between the Freeman Hospital and the RVI, the Trust's two main hospital sites. This was an exciting opportunity for the catering manager, Jeff Moyle, pictured here, to expand the environmental changes he'd already implemented at the Freeman Hospital. At the RVI, at this time, breakfast used to be served on disposable bowls and plates, and disposable cutlery was used. We also used disposable bowls for soups and desserts throughout the day due to the trolleys that we use to keep the food hot while it travels to the ward and waits to be served to the patient. We worked with our catering supplier to produce bowls and well-fitting lids that could be reused, but could also withstand the temperature and length of time they would be kept heated. The wards were also provided with reusable cutlery and dishes that they keep on the ward for breakfast times, and the job of cleaning these items has been absorbed by the ward housekeepers. Anecdotally, patients prefer the real cutlery as it's more like what they're used to and what they would have at home. So, you know, that's helpful for the patient experience and trying to make things as nice as possible. This project had an outlay initially of around £12,000 for reusable items, which seems like quite a lot to spend on cutlery and things. But we have reduced our consumables costs by about £80,000 per year. We have not calculated the increased cost for the energy and water use from washing the items, as it's pretty diffuse and it's spread across, you know, the 100 or so wards in the hospital. But these figures just lead your director the pleased hours. It's not often that you get a sustainability investment that pays back within 2 months. From that project, we have reduced the number of single-use plastic items used at the RVI by 2 million per year across these 5 items. These items would not have been recycled because they would have been contaminated with food, so this is a great improvement. When we started this project, all wards were sent a letter explaining the changes to provision and ordering and the reasons for reducing plastic to ensure that we had their understanding and buy-in, which I think is very important. People are usually a lot more receptive to change if they understand why something is being asked of them. So some of the next steps for us within catering, we're going to be working through our commitments in the NHS Plastic Pledge, removing items and finding alternatives where necessary in line with patient need. We'll be working with the food outlets in our hospitals to reduce their plastic use, though we are facing difficulties with this at the minute as they've ramped up the use of their disposables in response to the coronavirus pandemic, which puts a highlight on looking at the disposables you do use and making sure that they are, you know, as environmentally friendly as possible, though it's a very contentious area with no clear-cut answer at the minute. We're increasing options for drinks in cans so people don't have to buy a plastic bottle, though there are carbon implications for this, so we are treading lightly and weighing up our options before removing bottles altogether. Again, nothing seems clear-cut in this area. And we'll be trialling a project to remove single-use cups entirely from the bistro in one of our staff office blocks where our finance, IT, HR teams are based. Here, all staff have a dedicated desk, so they are able to store a reusable cup. So that is the perfect place to introduce the trial. This has been put on hold for the pandemic, but if it is successful, then we will look to roll this out to the RVI, which also has a staff-only outlet. Upscaling this for patients and visitors to the Freeman Hospital will be more difficult, but we'll develop plans for this down the line. But I'm very excited about that project because, you know, if we just ultimately remove that option, it can change behaviour and I'm hoping that, you know, as we progress through climate emergency and general understanding of the issue of plastic grows, we will move away sort of societally, culturally from this throwaway feeling, this throwaway culture. So that's it for me, but I'll be answering any questions at the end. Here are my contact details, so if you want to get in touch directly or your questions are answered. Also, a little bit of a shameless plug, but we have just released our annual sustainability report this week. And if you head over to Twitter, that should be one of, if not the most recent tweet from that handle there, @sustainableenough. And here you can see some of the achievements we've made over the last year. It's also available on our internet page. But it's very old. Searching and optimizing it's not brilliant. But there's a link there. But that's all from me. So thank you all for listening.
Great. Many thanks, Amy, for this very interesting presentation. Indeed, we have many questions, and I would like to thank the participants for their patience. We will probably run over 5 or maximum 10 minutes, but the recording will be shared with all the participants. So I would like to go through some of the questions, and I would like to start with you, Amy. There is a question from Grace, and she's asking, in living with COVID, has the reusable cup program been paused, or how did you adjust the program because of the concerns with the COVID?
Yeah, slightly different at 2 hospitals. At the Freeman Hospital, it is still running, I believe, because people fill their own drinks. The coffee machine is within the sort of restaurant area, the self-serve area, and within the sort of little shop we have that has a self-serve coffee machine, that is still in place. But at the RBI hospital, where staff would have to physically hand it over to the member of staff to handle and put under the machine, yeah, we have had to stop that during the pandemic, unfortunately.
Okay, thank you. And then now read out a question for Estefania from Julie. She's asking if the life cycle analysis for the use of glass against plastic for meal containers was carried out, and if so, if you can share more information about the carbon footprint, if it was higher with using glass due to the weight of the container. And we received many questions regarding life cycle assessment in general during the webinar.
Ariana, can you repeat the question, please?
Sure. So Julie is asking, has life cycle analysis for the use of glass against plastic for meal containers being carried out? If you carried out the life cycle analysis, she's asking about the carbon footprint of the glass, if it was higher than the plastic container.
Yeah, the weight is bigger with the glass container, but for us, there's not a problem. It's reusable, so we don't find a problem in that.
Okay, thank you. I now have a question for Oli. What challenges did you encounter in the procurement process system? I guess this refers to the dressing packs.
Luckily with the switch over, we use an organisation called NHS Supply Chain. It's effectively, I call it the Amazon for the NHS. It's got everything you could possibly want on there. It has its drawbacks, but it is convenient. And all of those items were available on there in bulk on big rolls, or sort of boxes of gloves and things like that. So there were very few hurdles with procurement for this particular project, although there are much bigger issues with NHS Supply Chain as a provider of lots of materials to the NHS. For instance, sort of choice of sustainable alternatives. We haven't even sort of scraped the surface of checking that, you know, the singular items that we are moving to. Where do they come from? What are they made of? How are they transported to us? Are there factories that are producing this using renewable energy, or are they burning lots of fossil fuels in the production of these materials? So this is just a first step, and I think there's lots of questions we need to be asking of our supply chain, but it's also quite exciting at the same time.
Okay, thank you, Oli. I also have another question for you. How do you engage clinical teams that aren't as enthusiastic as the team they worked with this example?
That is a challenge. I would say from sort of history of sort of talking to various different clinical teams, I would say try and keep it patient focused. At the end of the day, they're not really bothered about money or you know, saving the organisation money, or, you know, they are literally just interested in, you know, how does this help the patient, and how does it make their work easier as well. So I think if you can frame it in that context, then you're halfway there already. There will always be some people that you just can't, you know, convince, and that's fine. I think it's okay to go around those people and work with teams that do want to. But if you can relate it back to the patient and their work specifically, I think you're halfway there.
Okay, thank you. I'm going back to Estefania now with another similar question. How did you gain support from hospital management for this project? Was it hard, or you encounter any other challenge?
In the beginning was difficult, the support, but with our literature was more easy because there are so many articles, and you can find that glass is 100% safe, but not the plastic. Because in prematures, you cannot use substances that are not safe for the prematures. The precautionary principle is what moves us as doctors.
Okay, thank you very much. I also have another question for Amy. Perhaps you already answered your presentation, but how did you manage the sudden increase in items that need to be washed on site? I guess it refers to the reusable in the patients.
Yes, we use the pasteurization. The pasteurization is a process to heat the milk. This microbiological is safe, and there isn't a risk, a microbiological risk with the pasteurization.
Thank you, Stefania. Amy, in Newcastle, how did you solve with this problem of washing, if it was a problem?
I need to be, I think, careful how I word this. But when we went to the wards and we explained why we were wanting to make the change and what that would entail, we spoke to sort of sisters and domestic services managers about them taking on the responsibility of cleaning the items. Some wards have dishwashers already, a lot don't, and the majority of wards, it took a little bit of persuasion, but the majority of wards were happy for their housekeeper. So this is sort of a domestic member of staff who sort of works specifically on one ward to take on the role of cleaning those. There were some areas where the housekeeper had absolutely no spare minute in the day that would make this feasible. So there are a couple of wards that send the items down to the kitchen, and then they are cleaned sort of through the industrial dishwasher that we use and then sent back up each morning. But this is a very, very small percentage of the wards. I think it might be 2 or maybe 3 out of the 50, 60 that we have at the RVI. So that's how we've done it. We didn't have to take on another member of staff. It was sort of absorbed into roles that already existed.
Thanks very much for clarifying. We still have many questions, but unfortunately we have already passed the hour, so I'm afraid we have to stop here with the questions, but please get in touch with the speaker, Health Without Harm, if you want to learn more. Before we conclude, I want to briefly mention that through Plastic Free July, Healthcare Without Harm Europe will share more resources on this topic for our members. And I also would like to remind you that we still accept participants to collaborate in the Procurement Plastic Working Group, and you can register to the working group through our website going on the Healthcare Market Transformation Network page. So thank you again for being with us this afternoon. And thank you to the speakers. It was great to learn more about your journey, and I hope that the information and experience shared during the event will be helpful for all the participants that have to make purchasing decisions. The webinar has been recorded and will be published together with the speaker's presentation on our website.